Hi, I'm Natash Bryant and this is conflict resolution. The communication issue identified from inquiry 2 is conflict resolution. Conflict is defined as a struggle between at least two independent parties who perceive incompatible goals, scarce resources and rewards, and potential interference from the other party in achieving their goals. Conflict can be due to differences in ideas, perceptions, desires, responsibilities, goals and needs. Conflict is inevitable between colleagues, particularly in the clinical environment, as patient needs can be complex and frequently changing. Conflict is healthy, common and necessary for team growth. However, conflict can become a problem when it is personal or gets in the way of completion of a task. Barriers to communication can be due to a disagreement about the understanding of information, the reasoning behind decision making or feedback, differences in ideas or principles, differences about organisation priority, value or tasks, not understanding the expectation of others or self. Barriers that may negatively impact on conflict are emotional reactions. One emotion associated with conflict is irritation or annoyance. Misunderstandings can also be a barrier to effective communication, causing negative conflict. Misunderstandings can occur when there is a failure to understand, interpret words, ideas, intentions, and associated feelings. Communication skills. It's important to know your own professional boundaries and know your strong sides and weak sides. It's also important to consider people's body language, facial expressions when assessing reactions, such as irritation, annoyance, or confusion. Irritation or annoyance can be resolved by identifying the issue. For example, "Are you feeling okay? You seem irritated today." Or I statements such as, "I am annoyed as I asked you to complete the task for me and you have just been watching the television all day." Acknowledging the misunderstanding and admitting to mistakes can avoid or de-escalate conflict. People can deal with conflict in different ways. Some people may deal with conflict via aggression, expressing their opinions in a manner that intimidates or attacks the other communicator. Aggression poses that the person needs to defeat the opposition in the argument. The most common reaction of the listening communicator is to react by fight, e.g. they need to win the argument, or flight, escape from the argument or situation. We will now perform a scenario for aggression. This is Erin, the senior nurse, and I, Natash, will be the graduate nurse.
You should have showered all your patients by 8 o'clock. Graduate nurses these days have no perception of time management.
That is an outdated way of thinking. You need to get with the times.
And on top of time management skills, young nurses these days have no respect.
A passive reaction to conflict is when a person does not express their ideas or opinions. This person avoids and withdraws from the conflict. They believe they do not have the right to express their opinion and they may have low confidence, self-esteem or self-respect. This is an example of a passive reaction.
You should have showered all your patients by 8 o'clock. Graduate nurses these days have no perception of time management.
Sorry. Assertive. The assertive individual expresses their perceptions, ideas or opinions in a way that upholds the respect of others' opinions. This conflict resolution style compromises for a win-win situation. This is an example of assertiveness.
Graduate nurses these days have no perception of time management.
Sorry, I have been unable to shower some of my patients yet as they are sleeping and requested to have a shower later in the day. You seem unsettled today, Jan. Are you okay?
I'm sorry, I'm just stressed out as my father's had an operation today. I'm sorry, I didn't mean to take it out on you.
That's not good to hear. I hope he's okay. Let me know if there's anything I can help you with or you need to talk.
Thank you for understanding.
The most effective manner of response is an assertive response. Ways to be assertive is to use I statements such as "I did not like it when you described the behaviour that you did not like," such as "when you yelled at me in front of the patient." State the consequence of their behaviour, such as, I felt embarrassed. Finally, describe how they can change their behaviour to resolve the conflict. For example, next time could you please speak with me away from the patient if you need to make a point with me. The model that is useful for an assertive response is the DESC acronym. Describe the situation, express your feelings about the situation, specify the change or action that you want, and consequences, identify the desired results. For example, Mrs. Appleberry has not had her post-operative observations checked for 2 hours. I'm disappointed that you've not taken Mrs. Appleberry's observations, and it is vitally important for you to monitor her after her procedure to anticipate and avoid any post-operative complications. Could you please go and take your observations and remember to take them as per the hospital policy in future? This will ensure that we can anticipate or avoid any post-op complications for the patient. There is now a question for the class. According to the DESC acronym, what does the S stand for, and how would you respond to conflict using S? Thanks for the presentation today. I hope you enjoyed it.